passionate, right? I guess we all need to have passion to be good at what we do. And I say Dr. Lee is very passionate about athletes, no matter what the game that you play. I know he tends to MMA fighters, to badminton, to pickleball, to a lot of athletes. No matter what level of athlete you are in, what age you are in, you would see a lot of athletes at his office. And so thank you, Dr. Lee, for being here and his esteemed staff. Moving on to Dr. Uma Jamchit. And I'm sorry, I don't call her by the last name, so I hope you're okay with that. Again, board certified internal medicine doctor, but that's not what I want to talk about when I introduce her. If there is a day that she is not playing, I think she must be really, really busy. Her and his wonderful partner, Srini, here, who is sitting in the second row, is always on the courts trying to help. One of the key things that I would say that's most interesting to me about her, and I'll tell you why I'm telling this. So she's playing, and she will be, from her partner, she'll be always encouraging. Oh, that was so close. If I hit a bad ball, 10 feet in the air outside the baseline, she's like, oh, that was so close. I'm like, seriously, Uma? And she started even encouraging her opponents. Oh, bad luck. Again, she's going to be in our Alta team, and is a wonderful asset to our club. Thank you, Uma, for anchoring, one of the anchors for our session today, and being a part of APA. Dr. Charles, or we call her Charles, Dr. Anthony Charles. Again, a practicing oncologist. He has got too many fellowships and residency. I forget about all that. But the interesting thing about Charles is his neighborhood court is where APA was formed about 2.5 years ago. We were just a few folks who was just hitting the ball, and from there it's, to today we have grown to hundreds of members and hosting multiple events. And I'll tell you this one thing about Charles. So obviously he's a very busy man, and he a few weeks or maybe a couple of months back, and he came to me and said, "Man, why is everybody hitting on me? The game has improved a lot," and he's like, "They're all targeting me, Sunil, help me." So I wish Charles could come more into the courts and play with us. Again, Charles is going to be the anchor for the rest of the sessions, and he will control it and take it from here. Once again, welcome everybody. Hope you will have a good time. We hope to have a Q&A session. Again, folks online on our Google Meet and rest of our social media platform, please, we'll be watching the chat window. Please place your questions. And again, if you have questions in the audience, please have them come to me. What we don't want is the session turn into be a consulting session, so hope not all questions will be answered, especially if they are personal. Thank you, hope you will enjoy. On to you, Charles.
That's how we play, and then you realize, gosh, we end up with injuries. The second thing they always mention is having a good fitness foundation so that you can play long. And the third most important thing is, recovering properly with hydration, rest, and sleep. Because we will play for 3 hours in the evening, and then Srini calls me the next morning, and they're like, oh, ready to go, and then you realize, you end up with injuries, and they always stress the importance to give rest to the muscles even for a day, and they say it helps prevent the injuries. So with this framework, we have Dr. Lee and Dr. Umar today, and I'll request Dr. Lee to come in, give his presentation, and we'll go from there, okay? Yeah, thank you.
Hi, good morning, everybody. And I'm Dr. Jinjiang Lee, and I'm practicing currently in Alpharetta, Georgia. And I'm truly honored. I'm truly honored, and hi to everybody online and through different platform. I'm a little bit of a nervous. I'm a little bit starstruck because there's all the peers sitting here, and I have such honor to be presenting a little short presentation about the most common sports injury that we see throughout the game and throughout the last couple of years in the clinic, and hopefully we can shed a little bit light on how we can recognize, how we can take care of them, and how we can, most importantly, in my opinion, is prevention. So that way we can enjoy more time on the court and a lot less time in our office. Trust me, we don't want to see you that often either. All right, so let's start from a little bit overview. So today we're gonna just cover a little bit over simple stuff, and what is pickleball, and we're gonna go over a little bit history, and we're gonna talk about the things that you might not know about pickleball and most common injury that happen throughout the game, before the game, or even after the game, and what you need to know with a pickleball injury that when it happens, and what you need to do with them. And last but not least, nutrition, hydration, and a little bit tips that we can do at home for home care, things like that. Let's get started. Pickleball, we need a paddle and we need a court. And now we're seeing this big increase in numbers in courts throughout the United States and around the world. People are falling in love with this sports, this activity. And it's a combination with the basic elements from badminton to table tennis and tennis. And those things are quite physical required. So most of the time, a lot of our crowds who's playing pickleball nowadays also have a full-time job unless you're a professional athlete playing pickleball for a living. And that add a lot of a variable risk and the factors into what kind of injuries they are more likely to sustain. 1965, that's when it all started. But a lot of people might not know that. And this is for our congressman, actually, Joe Pritchard, Bill Bell, and Barley McCollum. And they created for the family. And for the summer, just trying to get, I believe we don't have any social media. We don't have any Instagram. I don't know how we deal with the summer. Maybe you go to the lake on a family trip. So this is a great sports kind of to add on to it. And you might not know that. It was named after their dog, Pickleball. Yeah. And you can read the rest of that. So, it's quite popular all around the world. And I'm pretty sure that number is going to grow more and more. And people are receiving it. And also, there's another thing. A lot of time when it comes to pickleball, a lot of people think that pickleballs are for our elderly people. That's not true anymore. Used to be the mean age around 53 years old, but I think that age has dropped a lot, quite lower. And why do injury happens? We always ask the question. We get a patient coming in the office, say like, "Doc, why does this happen to me? Why that doesn't happen to another person?" Things like that. Unfortunately, I agree. Bad luck sometimes. Bad luck. Yeah, it just like happens. And other things that we really need to kind of look into it, like we don't take enough emphasis for warm up. That's one thing we're going to emphasize today. It's the warm up. The inappropriate physical conditions I'm not saying this is a pickleball saying it's for certain type of people when you play, because that's the reason why it's so popular nowadays, because pickleball has been received great popularity in different demographic, different groups, different age, and they can come up a lot of different games right here. But however, if we have a certain kind of a condition that preventing us to play as a normal game, that increasing that risk. And also, when we have a back pain, when we have a neck pain, when we have a certain kind of pain, we usually just walk it off. We usually just say, it'll go away. I'm still gonna go play the pickleball. And most of the pickleball game, according to my understanding in my office, it can last up to 3-4 hours. And that's a quite bit a long time for strenuous, a continuous extraneous exercise or competition, especially when you try to win something or try, for that title. And also, most common for majority injury that we will see is actually overuse type of injury. And that happened, it went away. Okay, I'll keep playing. Maybe 3 months later, something else happens, or same problem came back. And then you see that frequency become shorter and shorter, more and more frequent. And that's what we usually see those most common injuries. Those are the overuse type. And then we have acute injury, immediate injury, that happens from some ankle sprain. Last time we have a very, 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 I would call epic case and the gentleman's here at in our room right now, and the ankle just blow up, but there's not much pain. It's really fascinating to see all kinds of injuries just happen on the court, and we need to know what to do with those kind of injuries. And let's moving on to some more specific type of injuries right here. Today we're going to cover a little bit of everything all over the body. Neck pain, back pain, those kind of things are pretty common. And then in each individual cases, I strongly recommend you guys raise the question, go to talk to your local community. Those doctors are passionate about taking care of those local community. In my office, we are for our local sports community, including pickleball. We have many offices, they do the same thing across the world. So reach out, talk to them. They are here to help. They are here to help you to stay in the game longer, stronger, and an even better performance. Shoulder, elbow, lower body, usually it's knee, a lot of times it's the ankle. And we need to take a look at all the signs and symptoms. So we're going to focus on a little bit, what if injury happens, and we want to kind of focus on a couple of things. That's the whole first thing you want to look is, can you move? Can you move that injury? Is that an immediate? I don't think you should play anymore if you cannot move that normally. Can you put a weight on there? If you can't put a weight on there, we need to call that the game. So. And also we need to take a look at the color changes. Are there red? Are there purple? Are they starting having all those things kind of showing up? Like, oh, that's not normal. My skin is not looking correctly. And then making sure always go to check with your health profession. Always ask them. Don't just try to assume it's a simple injury. Recently, we have 4 cases. The patient thought it is just a minor injury. But when it comes to the office, we do the exam, we go through the history, we say, let's go do some diagnostic imaging, and they are all out of game. We want you guys to stay in the game. So making sure, don't assume just a simple sprain or strain, it'll go away in about 3-4 days. And shoulder. I'm putting a little bit of information right there so you guys can read about it, and I'm just gonna focus a little bit. As you can tell, that shoulder is connected to our upper body, connected to our neck. There's a lot of intricate, lot of complicated structures right there. They are all working as a team to make sure we can have a normal functions, and the normal range of motion, the strength, all that things. If you take a look, there's nerves there too. So sometimes so when they have a shoulder injury, they usually will have some kind of neurological changes. Burning, most of the time people saying, I feel burn, I feel ache, I feel my fingers a little bit numb or tingly, those kind of situation. And those things for shoulder, in pickleball, we see a lot of more overuse type of injuries. When, for example, you work 8 hours a day, or 10 hours a day, it depends your job. And you go to Costco. You get really excited about those deals, but those are in bulk. You buy water, you buy the rice, you buy all kinds of things. They're heavy, and then you just swing that and throw that into the back of your truck or car, and your shoulder next day is kind of sore. And then here's the game Tuesday, and here's the game Saturday. Sometimes 3 games a week, and your shoulders start to bother you. But you still keeping doing the same range of motion over again. Maybe by the game 3, you having trouble lifting your shoulder anymore. And that is when we need to kind of emphasize when you have shoulder dysfunctions or a shoulder pain showed up. One thing you can do is a self-care, right? So we all know the old-fashioned way is called a RICE, however you call it, protection, rest, ice, compression, and elevation. Now, in the sports medicine world, actually in the rehab world, we have a lot of update for those kind of things. So for for the individual, I'm not going to go into the details, but there's a lot of, it's called peace and love. And then, so those kind of things, those are the acronyms for the new management. If anybody having questions, we'll be more than happy to get back with you and to answer those specific questions. And what can you do? Same thing, try to protect yourself by changing a little bit, modify a little bit of technique. And maybe it's a technique issue. Maybe it's just that elbow cannot raise high enough, or maybe that wrist roll is not efficient. So you're compromising, you're using that shoulder to try to catch up the game, to keep up with the pace. And that's one thing we need to look at it. So there's a lot of muscle also. If you work on a computer, our upper and lower cross syndrome is going to show up. Our pec is going to be tight. Our post side of or back side of a shoulder is going to be a little bit of imbalanced muscle groups. And then you throw that shoulder into a game for 2 hours. I don't think any muscle will be happy about that, right? And pickleball elbow. So we also take care of a lot of tennis players and tennis elbow, aka pickleball elbow. However, the elbow you call, and I found this a very helpful picture. You see how many types of elbow pain it is? Do you think you can handle that by yourself? Just say I have elbow pain, I'll just put an ice pack on there. Sometimes it helps. It may just help, short period of time. We need to take a look at what's the cause. What's the emphasis? What is going on that troublemaker in that elbow? We can have bicep involvement. We can have a forearm muscle, is what we call the flexors and extensors. Sometimes our fingers. And with that being said, and in order to find out what is the primary causes for different elbow pain, we need to look into that primary cause, and may want to think about training, strengthening, stretching, and also equipment. And I believe that Dr. Uma is going to go into that part of it. So I'm just kind of emphasize a little bit right there. So it's very important to look into those technologies. And it's just not a simple paddle game with a ball. Lower body. When it comes to lower body, most important thing I think is for balance, for strength. Because we kind of fall into this kind of a cycle. Is I have a leg ache, I have a knee pain. When I stop playing, it stops. I'm getting better now. I'm not worried about it. And later on, it comes back when I go upstairs. When I go downstairs, it hurts. But do you know if you have knee pain going upstairs versus downstairs, that means different things. That's not just a knee, because our knee is a really strong, stable structure. When you have a knee problem, you got a bigger problem to deal with. It could coming from your ankle, it could coming from your hip. And sometimes, in the cases, it could be even from your lower lumbar and disc issue with that knee pain. Of course, you also have other internal inflammatory response, arthritis, or rheumatoid issue, those kind of things. So, and try not to ignore that part of it. So, and especially when we sit in front of the desk, when we drive, especially in the United States, I think a lot of time people prefer drive than walk. The muscle relationship, our quads versus our hamstring, our glute activation, those things are going to be modified just because we are not using that as much as in some individuals in different countries that they may put a lot of strenuous training in their lower body. And with that being said, right here, we're looking at those kind of things. How can we kind of protect a little bit? If you already have a knee pain, it's not the end of the day. Make sure you get evaluated. Make sure we get a proper rehab so we can get rid of those pain. That's the most important part of it. However, when you play, you might want to consider about a little bit supportive, the braces. You want to have a little bit knee compression. Sometimes patellar tendon bands, like you try to kind of reduce a little bit that tendon pain and in front of your knee when you bend. And again, warm up. Recently, we have players and ended up like without warm up, playing a tournament, pretty important, and the first game out. ACL complete tear because of that warm up. It wasn't really there. They just jump right into the game. And I'm not saying they don't have an underlying issue, but if we don't properly warm up ourselves, the muscles, those muscles might be a little bit of a delay to respond to that intensity for physical requirement, especially when you're playing some more important higher level games. But usually, you will see this, if it's higher level athletes, they may be be more aware of like, I need to warm up better, or seasoned veteran pickleball player, tennis player, whichever the game you play, you probably see them spending more time on that court, next to the court, or however there's a warm-up area, and they are spending their time doing their work. And so that way they can make sure their muscle is already fire when they're ready to play the game. Couple things: sudden move, twist, excessive like rotation during the play. Those things are very, very common to see. If you see a lot of your partners, certain people, they just play the game like a jittery. They're kind of jerky movement, right? They're quick. They plant their foot like a solid. So with that being said, you want to look into a technique. I am a senior contributor to Sports at TV, and it's a phenomenal platform worldwide for many, many sports, including pickleball. They have a full library of a video tutorial for pickleball to teach you different movements, to improve the skills, everything like that. As a partner for APA, here, all the members here, if you just reach out to us, and we will get you connected, so you'll be able to access all those information, and you will benefit from all those tutorials to improve a little bit of work on your footwork, on your pedal work, all the things like that. So I just want to throw out there sportsedtv.com, and then you'll be able to find the whole pickleball. And also there are some injury prevention, all those things. We wrote an article about it. You can read about it there too. Here you go, ankle. I can show everybody a little not a trick, but it's more like a knowledge. So now you're gonna feel more competent about it when it comes to injuries. What am I supposed to do with it? If you use your same side of hands, to grab same side of ankle. You just reach to grab the ankle. And if you want to do it at home right now, feel free to try it. Reach out, and the people here at seating, I want you to reach out, grab your own ankle, grab it. There you go. There you go. You grab the way, just regular way to grab it, like thumb facing up, so it looks like this. It's just like this. You're gonna grab the ankle. You grab that. All right. Okay. So if the pain is underneath your hand, that hand. Okay, so the hand area covers the ankle. If you have that, right here. If you see that, the pain is underneath your hand, you need to get it checked. Okay, that's one of the signs. Like it's actually Ottawa rule, like we're using for ankle rules. And so if you have the pain in that area, you can't walk. And you grab the ankle like that. It's like, yeah, you know what? It's underneath my hand right there. You need to contact your doctor. Whoever is your favorite doctor, your physiotherapist, especially a lot of overseas, your physiotherapists, orthopedic doctors, family doctors, sports chiropractors, whoever is your doctor go to, you need to contact them, because those areas are the problematic area, especially when you twist the ankle and the injured. You need to making sure everything is intact, so it doesn't leave you a little bit of a question. You keep playing on there, and that might cost you missing more games out, right? Again, landing shoes. This is just in my opinion. I'm a big advocate for shoe wear when you play pickleball, including tennis too. Shoe wear. And nowadays, everybody, if you don't have the opportunity or access to get your analysis by your providers, I recommend you should look online. You should look into your local providers. Like a lot of them, actually, they have all the technology. They have all the knowledge to help you to choose better shoes. Not saying the most popular shoes are perfect for everybody. Everybody's shoes is different. And nowadays there are some shoes out there, like they have a great technology to it, but they pose a lot of a risk for instability if you have a foot or ankle dysfunctions. So that shoes actually didn't really help you that much, and it costs quite a money to get those shoes. But actually, you kind of make your foot hurts worse. Sometimes knee hurts worse. Plantar fasciitis from pickleball. It shouldn't happen. It should not happen that plantar fasciitis or the bottom feet hurts, those kind of things. So making sure look into that part of it, and answer to those. How do we improve all those things? How do we prevent all this lower body injuries, including upper body injuries? Agility training, cross training, that's something we're going to talk into a little bit later, because those things are absolutely beneficial. Research has been showing over again, it has been proven it's very effective for athletes and individuals to kind of try to reduce that risk of injury and during a game. Achilles tendonitis, that's another thing I throw in there to kind of share a little bit in the back of it. You see this a lot more in tennis versus pickleball because of that weight bearing and that stance when you're getting ready to receive, other than serve, those kind of things. And then also stop and go and changing directions, that deceleration, a lot of things will causing our back of that Achilles tendon or calf gets very sore, and those kind of things. And also, this is second trivia I would say I'd like to share with you guys is when you have your calf pain, just like the ankle, I'm going to show you another thing right here. So if you have your calf pain show up, and if you point, you squeeze your calf right here, versus you squeeze your calf or Achilles tendon towards your heel, and that means different things. Okay, so if you have those kind of issue right there, you definitely have some issue in those calf muscles, and that's not just I walk too much over the weekend, and if I rest, I'll get better kind of situation, because you may have a higher risk to rupture that. So making sure, see if you squeeze the heel bone or if you squeeze that calf itself. And stretches for calf, very, very effective. And we're actually going to show you some of the stretches that you can do at home or in the office. Once you feel your calf is tight, your Achilles tendon is a little bit tender and tight, we can try to stretching out those different muscles. And so that way, you can do some self-care. If self-care doesn't really relieve the problem, guess what? You definitely need more investigation into that. That makes sense, right? All right, so our Dr. Uma is going to go into a lot of more here. We just kind of throw in there a little bit of the factors that can affect injury and the risk, or better way to say it is actually physical condition that will definitely affect how you perform and how likely you'll injure yourself on the court. Nutrition-wise, you need a balanced food. You're making and especially if you have a dietary restrictions, that's extremely important to talk to your doctor about how you can keep a balance with the nutrients, because there are certain nutrients it's very tricky. If we don't pay attention to that, we might not think it's a big deal, but actually later on it works quite well to causing overuse type of injury and a tear. And also hydration is very, very important. So that's pretty much I would like to cover a little bit basic information. I hope this is very helpful, and I'm going to give the mic back to Dr. Anthony.
Yeah. Thank you. Thank you so much, Dr. Lee, for a wonderful presentation. And we'll move on to the next session part. And basically, it's a bunch of questions that people submitted that came up again and again, and we were going to ask, some of these questions to Dr. Lee and then to Dr. Uma. And I know he briefly mentioned about it. Can you tell us, Dr. Lee, like as far as the warm-ups, is there any certain essential stretches that people have to do, and like how long to do and how many times? Can you comment on it? Yeah.
Yes, the warm-up part of it, and do we have the...
Yeah.
Yeah, so the warm-up, I think is, I put in the bag right here. I think it's the last one right here. Okay, so I actually add the slides there. I want you to think about, everybody should make a warm-up and non-negotiable. And I know it's time-consuming, but if you do a solid warm-up, that shouldn't take you more than 5 minutes or 10 minutes. But you should have a very good, effective way to kind of warm up. We want to making sure for pickleball, especially, and I put it on right there for the key points: rotational movements, warm up, multi-directional, and the core activation, and making sure your cardiovascular is ready. And so don't feel bad to jog for about 3 to 5 minutes before you starting to do any other stretches, because I always recommend everybody, how do you feel warm up if you don't warm up your cardiovascular, right? So when you arrive a little bit earlier, just try to jog around the course a couple of times and set a timer for 5 minutes. You should get your cardiovascular going. And then we're starting from some basic area: elbow, our knee, our hip, our ankle, and our spine, making sure we can rotate that back. So with that being said, we have some like basic dynamic warm-up tutorials that we do, because there are so many out there. It really depends on each individual. For this presentation purpose, that we didn't include there because we can't just say one cookie cutter for everybody. But look into dynamic warm-up. Just search online. There's so many videos, excellent influencers that they are out there giving you all those resources that you can learn from. So here we have some stretches that we're getting ready, but I do want to kind of focus a little bit on this one, body weight functional squats as a warm-up to be as a part of a warm-up too. We want to start with cardiovascular first, and then we want to kind of focus on a little bit of a ankle, knee, hip, and our spine. So this one greatly mobilize everything. And then you can add into some, like, for example, like a mountain climber or Spider-Man rotation or inchworm, those kind of movements, as long as the core's allowed to. And then so you pretty much can get some good dynamic warm-up. So for functional squats, right, but bodyweight functional squats, it depends on different parts of country or world you live at, and how we go to the bathroom. I like to use the bathroom for example, so that way everybody can remember vividly. It's a bathroom. We're having bathroom talk right now. So not everybody's fortunate can sit to go to the bathroom. Some places only use a squat. So the squatting is a very important moments right here. So we want to focus on that hip mobility and your ankle mobility, so that way you can make your knee joints a lot more stable. So that way you don't feel that little bit tension when you squat. I wasn't sure if I can play this, or if not, I will do a live demo.
Okay, please do.
Yeah. So should I do the demo or the play? Okay, so I'm going to do the demo. So I want everybody thinking about the hip hinge movements right here for sideway right here. So as we're speaking, we want to focus on the hip mobility part. I'm a big advocate for everybody. When they come to our office, we want to assess their hip mobility, and how strong, stable, or mobile they are. And you want to kind of starting from a nice both feet apart, shoulder a little bit wider than shoulder, in my opinion, to start squatting down. When you're squatting down, naturally, most people like to bend their knee first, like that. What happened is, I'm going to show you the side way. If our knee goes first, what happened to our back? Now, we will have to arch that back and get that very awkward position. And then their knees will start to hurt, so I can squat. And not true. A lot of time we have a knee problem, a back problem, patient coming into the office, we try to change a little bit how they squat, and they actually can do a squat with no problem, because squat shouldn't come from your knee. Squat shouldn't come from your back. It should come from your hip and your ankle. So you want to think about a hinge right here to bring your belly button close to your close to your inner thigh. Almost looks like you're trying to sit back to the chair. From that position, you're going to keep your arms in the front to keep balance. Play a trick with the center of gravity until you cannot move anymore. Then, in the meanwhile, you keep your knees relaxed right there, so that way you can start to squat down until your hip is going down to your knee with no problem. So from side, the same thing too. You want to kind of get that center of gravity and hip hinge. Keep your knees and or hip open. If you need to move your leg, it's okay. You can move your feet a little bit that way. So that way you feel more comfortable. Research actually shows the morphology for the same person, their hip angle, left and right, within yourself, they are slightly different. So we would like to kind of discard that for most individual that are both feet apart. A toe straight squat is out of a book. We don't like that one part. Because of everybody, that hip angle is different in relationship to your acetabulum. And so you want to make sure it's comfortable for your femurs rotating the correct way. So I'm going to show one more time right here. What you want to do is a feet apart, wider than your shoulder, keep your arms in front, keep balance. Hip hinge, keep your knee relaxed until you cannot draw back anymore. My back is relaxed. Bend your knee, keeps your hips open until you go down right here. If you need to move your feet a little bit, it's okay. Come on up. And eventually, you'll see there's a powerlifting too, or Olympic lifting. Everyone will have that issue. What happens if you have this issue? I can't move anymore. Then we need to address a little bit different things because for our most individual, our thoracic or our mid-back area has a lot of restrictions because how we sit, how we slouch, and we need to emphasize that part of it. So don't feel bad if you cannot squat as deep, as easy as possible. The whole point is get your movement going. So if this is your squat, that will be your squat. But keep doing it. If this is your squat, that is your squat. But we don't want you to do this. Heels off the floor, knee hurts, and we're not squatting properly.
That's amazing. Thank you.
No problem.
So the other question that came up, Dr. Lee, was what sort of balance exercises to do in order to avoid falls? Because that's a major issue with so many people injuring themselves on the court. Can you comment on it?
For the cross training, that's actually really good question. So here I just kind of jot down some quick notes on cross training, and a lot of people actually never really thought about why cross training, right? So the cross training, I listed about a top five benefits for cross training. The number one is it actually improves overall fitness, and the second thing is injury prevention. The third one is enhance the skill development. Four is a mental refreshness, and the number five is increased recovery. And the reason why cross training can help to improve the balance is because of you use different muscle groups to play pickleball. But when you train those muscles in different way of movements, and those muscles actually gets trained even more for skill-wise. So, like, for example, we strongly recommend, like, if pickleball people can pick up some swimming. So you practice that legs, your arm coordination, and your core stability. That's gonna improve your balance. And also for lower body cross training, you can do cycling. The cycling will greatly, increasing your agility and endurance, and also some of the step moving and just that coordination. It's really important to help those lower body development. And strength training is very important. I'm a big fan of that. You should always do weight training no matter what. If you take a look at anybody who's competing professionally, they spend quite a bit of time in the strength conditioning room to develop their skills and the strength. So that way they keep the whole body stronger. So that will make you more stable, so that balance improve. Last but not least, easily to access yoga and the Pilates cross training. So that way your tight muscle might thank you by the end of the day.
Wonderful.
Yeah.
Thank you so much. So these next questions are to Dr. Uma. Thank you.
Hello.
And the question that came up was, you keep saying you have to drink water, but the main thing is how much to drink, how much before, after, and during play. If you could please comment on it. Yeah.
Hello. Good morning to all. Hello. Hello. Yes. Good morning to all, and thank you for being here. And I just wanted to thank Sunil first for arranging this seminar. And I'm glad to be here, and will share my expertise from my field and also my experience on the court. So to begin with, hydration, it's important, like with any exercise or sport. With pickleball, hydration is important too. Dr. Lee talked about warm-up sessions, how important they are. And basically, warm-up sessions are to warm your heart and your muscles, to wake up your muscles. So to wake them up, you need healthy muscles. And hydration is what is important to keep muscles healthy, supple, and healthy muscles and tissue, less prone to injury. So that's where hydration plays an important role. So here, it's just a general guideline on how much to drink. It varies according to how much you play, how long you play, and times of the year that you're playing. But general guidelines are these: before you start your play, the 2 hours before your play session, it is recommended to have at least 14 to 22 ounces of fluids. Now, it doesn't mean, this is basically 8-ounce bottle. So 2 of these, minimum, 16 ounces is what is recommended. And that doesn't mean chug those bottles just before you get onto the court. What is recommended is over 2 hours before the play, you just take sips of water, slowly get it into your system so that the blood flow to the muscles increases, and once you start the play, they're not going to be in shock, and that's what leads to most of the injuries. So that's the before play. And then during the play, again, depending on your session, some play an hour, some play half an hour, whatever it is, every 15 minutes, 15 to 20 minutes, again, at least a small 8-ounce bottle or 16 is recommended. Minimum is like about 8 ounces of, so a few gulps. If you bring those bottles, a lot of people on the courts I've seen bring their water bottles that have like 32, 64 ounce, I've seen different sizes. So basically, this bottle is like few gulps. Even that is enough to keep your hydration going. And then after play, this one, when we end the session, we take a few gulps and leave, but your muscles are still active. They need to heal, they need to recover for your next play. So they still recommend the immediate period after the play, 2 hours after your session is over, hydrate well again, 16 ounces to 24 ounces, which is 1 to 2 bottles, or at least minimum 1 bottle. But you can also, if you're playing every day, there is a formula to it is suggested, a recommendation again. You can do before play weight and after play weight, and every pound lost you're replaced by 1 bottle of water, because that's immediate water loss, nothing but water loss when you're playing, because the weight loss during that acute session can't be your fat, it's more your water, so you replenish it. That's one way to look. But the simple formula in the bottom, I just wrote it: 1 bottle before, half bottle of that 16 ounce that I'm talking about, that's the general size bottle that we use, half bottle every 15 minutes, and then 1 bottle for every pound lost. So if you play 2-hour sessions, or most of our APA players I've seen 2 hours, we book the slots for 2 hours. So a bottle and a half is what I would recommend. Now, again, these are general guidelines. And can you do the next slide?
Sure.
And this just, I was talking about how hydration is important. Muscle cramps, like he was saying, warm-up sessions important to avoid muscle cramps. Now, you just warm up but not hydrate well, you will still have a muscle cramp. So important to hydrate, and these cramps are not just cramps, they're actually damage to the tissue. So I've seen people get childhood horses on the field, when they're playing, during a tournament or whatever. If they're not hydrated well, you have a cramp, and yes, the cramp goes away, but throughout the rest of the session, the muscle is hurt. It's not going to heal that fast. So best way to avoid is hydrate. And that's
I was
basically.
wondering, like, just water, or we have to drink any specific?
So I was going to suggest, in general, for shorter sessions, water alone is okay, because that is what you lose. But you know your body. Some people sweat more, some people less. So depending on how your body type is, and depending on the time of the year when you're playing. See, winter months, most people don't sweat much, so it's okay to just hydrate with water. But summertime, you sweat a lot. And sweating, you lose a lot of electrolytes: sodium, potassium, calcium, magnesium, all these 4 important for muscle function. So if you just give water and you're sweating a lot, you are going to have cramps, you're going to get fatigued muscles. So it's important to add something like liquid IV or electrolyte water. Part of your water replacement or hydration should also include electrolytes if you're playing in summer months, warmer days, longer durations. That's what's recommended.
Awesome. Thank you. Yeah, and the next question that people asked was, can you comment on the footwear? Is there anything specific we need to look when we buy footwear for pickleball? Yeah.
So as Dr. Lee mentioned, ankle injury is very, very common, and most of our weight falls on our feet. Unfortunately, they take the brunt of the whole body weight, and pickleball courts are hard courts. So, sole protection is important. So what is recommended is a thick cushioned sole, okay, and some kind of ankle support. And pickleball is a sport with lateral movements mostly, at the net, with the paddle, with the dings and everything, you're going lateral. And those movements are much more common than other racket sports. So it is recommended to have shoes with lateral support. And then these can be specific pickleball shoes. They've come up with several varieties now, but need not necessarily have to be pickleball shoes. But something like indoor court shoes, like tennis shoes or badminton, they have specific badminton shoes too. So all those are okay. So basically, lateral support is more important. There are some shoes with a lip at the ankle, a little bit of extension of the shoe margin. Those are even better because they give a little bit more additional ankle support. They call like lips in the back or on the side of it. So those are a little bit better too. And then running shoes, definitely not recommended because they are made more to support your body for forward motion, which is seen not that much in pickleball. Pickleball is more lateral. So it is important so they're not recommended not because they only support forward. They're not recommended because they do not support the lateral movements, which are important and are seen more in pickleball shoes. So preferably do not wear running shoes. Wear something like the indoor sport shoes. That's what's recommended.
Great, thank you. And the next question was, can you comment on the paddle grip? Because tennis elbow seems to be a recurrent problem, and how do we,
Yeah, as Dr. Lee mentioned, tennis elbow or pickleball elbow is what it is called. That is more because of, and pickleball elbow or tennis elbow is more of the lateral part of your elbow that is strained or sprained due to recurrent use. And as he said, wrong technique or overuse are the most common reasons for this injury. And it is basically an injury that occurs because of strong contraction of these muscles that support the forearm and connect the elbow to the arm during load. Basically, you're trying to hit the ball fast and contracting these muscles, and it puts so much tension at the attachment of the at the elbow. That's what causes it. So there is a way to measure your grip size. This is again a general guideline. They say from the middle of your crease in your palm, the bigger crease, to the tip of this finger, the fourth finger, is what you measure, and you can, that's the whole circumference of the grip. That's recommended. Again, it varies from person to person, but there are some online recommendations in general for if you're a certain height, you probably are better off using this grip size because in general it works for that height people. So this is a general guideline that you can use. And what I would say about this pickleball elbow is like, yes, it can happen. We don't know who it happens to, because you may be doing everything right technique, and it can still happen. The key to it is like, if you know your backhand is weak, you can even try to prevent this by wearing a compression sleeve to protect and give extra protection to that site while you're playing, especially if you're playing a lot. That is okay to do that too.
Awesome, thank you. And the next question was how to treat acute injuries, what to do, if you suddenly have pain on the court, what exactly to do.
So initial management of any injuries, this is just a general guideline, goes with any sport, but pickleball specifically, we can follow this regimen on the court for immediate injuries. And there's an acronym that they say PRICE. Before it used to be more like RICE is what people have heard most, but they added a little bit more to say PRICE because The protection part of it, as I'll talk a little bit more in the next slide. So it's protection, rest, ice, compress, and elevate in that order for acute injury. So protection basically, you can go to the next slide. So protection basically is like, once you see the injury has happened, whether it is your knee or your ankle, the first thing you do is unload and avoid any movements in that area. That's the protection part you're doing. So protecting the joint or wherever the injury has happened from any further injury. That's what you're doing. That needs to start right on the court itself. So instead of like, okay, I'm going to finish this 1 or 2 points and then, let me go see what happened to me. I would rather say, okay, let's stop. Let me first see what happened, and then we'll figure out if I can even continue to play or not. That's what the protection part is. And then the rest is, again, it varies from the type of injury. Initially, it is advised 48, 72 hours for a moderate type of injury. For minor injuries, as long as Dr. Lee mentioned, if it's, say, it's your ankle, you take a few steps, you're able to walk, and a couple of light jumps you're able to do, you're okay to continue to play. That doesn't generally suggest any major injury. So that's how I assess. So rest part varies, but it is recommended for the tissues to recover so that you can play further. And ice application, I know people don't carry ice all the time, so this is one of the things I don't know how to solve the problem, but as soon as you can get access to some kind of cold compress, this is the first thing that is recommended for calming down the tissues. How ice helps is basically reduce the swelling, which heals on the swelling. And, winter months, I've seen people carry water bottles. They are almost like ice. You can use this on the areas. I've done that a couple of times on the court. People get hit and, they have some swelling. Go put the water bottle there. It's almost very cold. So you can try that as an immediate thing that you do. So next slide. And then the compression part. This is what, is recommended, again, to continue healing. There are different kinds of braces and support devices for each joint based on the type of injury. The ones that I have seen on the court and people have used and I recommend more are sleeves. Sleeves work very easy. Put them on, take them off very easily. And these may not necessarily be only used during injury or for an injury. You can use them even to prevent injury. If you know your weak points, like you say you have bad knees or you've already had some issues in the past with your knees, you can always start off playing with a sleeve for the knee to protect and give extra support while you're playing. So these can be used for that too. And then elevation, again, wherever you see swelling, to reduce the swelling, you have to elevate 48 to 72 hours. That's what's recommended. So that will be good.
Sounds great. Thank you. And is there any danger symptoms that when they have to seek help immediately that they have to be aware of?
Yes, a good question. For normal injuries that do not have any obvious open wounds or deformities that you see, these techniques work for that. Now, if you obviously see a big cut, okay, that you can't put ice there, you can't do anything. Stop the bleeding, seek medical attention immediately. Some may even need sutures. And then the other parts, obvious deformities. So like I was talking, dehydration, cramp can make you fall, you can hurt. People with weak bones can have a fracture. All these things, any deformity you see, it's not something you can handle right there. Seek medical attention immediately. And I've seen that happen a couple of times on the court, dislocated finger joints because they tried to brace a fall. And I was able to reduce it on the court, that day, but sometimes those things, some of them you cannot do it. So seek medical attention with any obvious deformity and open wounds. And I would say we get a lot of cuts and scrapes and abrasions, fall, you just rub off and go forward. So I also recommend updating your tetanus injection. People kind of ignore, but every 10 years you need to have a tetanus booster. So I would recommend that. It goes with every sport and pickleball too, because I've seen a lot of scrapes and, falls and knee scrapes and open wounds. So that's another recommendation I would give, definitely. Update that.
Thank you so much. Does anyone have any questions for Dr. Lee and Dr. Ma? You can use my mic.
Hello. Hello. Yeah, the question that I have, Dr. Lee, is for you. The warm-ups that you're suggesting, between the warm-ups and actual game, how much time typically you would recommend that? Meaning like you do the warm-up, get into the game, or sometimes you have to do at home, drive, go to the courts and etc. So what's the recommended time?
That's a very good question. In general, I would recommend, because a lot of time our pickleball community, they have all the errands to run, and then you're going to the game, right? If you have time to warm up at home, I would say within about 5 to 10 minutes, it wouldn't really cause too much trouble. You're not really cooling down. It depends. If it's winter, I recommend maybe there's some dynamic stretching, dynamic movements that you can do just by the court. You arrive there maybe about 10 minutes before the game. So once your game starts, there's a quicker transition. So it depends. There's a lot of variance right there because of the humidity, the temperature, and also in the morning versus during the evening. Those games are, requires your cardiovascular. In the morning, you might need a little bit longer time. In my opinion, I personally recommend get there, do your warm up, and get in the game. Just in case you get stuck in traffic, you never know.
Awesome. Thank you.
I just wanted to add to that. So it's better to have even a couple of minutes of warm-up than no warm-up at all. So, I see people come and jump into the court. Even if it is 2-3 minutes of stretches, it still improves your blood flow and is good enough to start with. I know we're all busy and we want to play more, but 2 to 3 minutes also goes a long way. That's what I recommend.
Sounds good. Thank you. Any other questions? Yeah.
Question from the online viewers. Somebody have had a serious trauma and had to do some surgery, so probably a question for Uma. So the person is trying to get back into the game, and is there anything specifically you need to be worried about? Let's say this person had a calf muscle that was injured and had to do a surgery.
So initial injury, like I was saying, rest and all the 4 things that you do, you seek medical attention. If it's a partial tear or a bigger injury that is not going to heal in a few days, your doctor will recommend, of course, the amount of duration of rest. Now with pickleball or any other sport, and I'm going to talk more about pickleball, is like when you love it, you want to get back into the game. So I'm not going to say rest it for 8 weeks or 12 weeks or complete rest for this long. Unless it's a major injury, but complete rest is also not a good idea because then you're trying to get back into the game. It takes, again, your body getting used to everything all over again. So there's something called offloading in the beginning where you're not going to load the area by giving it rest. But the onloading or progressive loading is what is recommended, where you slowly start with movements that are seen in the game. You can do them at home. Start with those movements, warm up, or, get your muscle memory back and start using it, and then slowly get back into the game and see how you do. You start the game, one session of the game, your injury or your muscle is crying out more and you're having more pain, then you scale back and reassess. But complete rest for long durations is also not recommended, and it goes with any sport. And you have seen football injuries, cricket injuries, whatever they do. Acute care is done, but they have to go back to rehab and get back into the game as soon as possible. That is what is recommended. So it depends. It can vary with the time. So say if it's a fracture, you cannot do anything for 8 weeks period. There's no offloading, no unloading, the bone has to heal. For muscle injuries, progressive loading can be done cautiously to get back into the game.
Sounds good, thank you. Any other questions? Yes, sir, go ahead.
Doctors, what's your opinion on eye protection? I didn't see that in your presentation, but very important, I would think.
Yes, definitely. I have seen some protective eye gear worn by people, and I myself, I mean, I've seen it in other sports like football, and where there is more contact, person to person, and more forceful injuries are a risk in some sports. Pickleball, the main injury is like the ball hitting you or your own paddle hitting yourself. So there are some eyewear, I've seen it, glasses, some without any lens. It's just an eyewear where when the ball hits, it doesn't hit your eye, it just hits the frame and it bounces off. And yes, depending on how often you're playing, how much you're playing, and how aggressive and what level you're operating for and above with shots that are going to fly off all the time, protective eye gear, yes, it is recommended. Yes.
Okay. Dr. Lee, do you want to show anything, stretches, anything, demonstrate anything? Yeah, please.
So there are two things we like to do here is I have Dr. Reyes with me, and I'm just going to grab this table over here.
You can keep it there, yeah.
So Dr. Reyes is going to demonstrate some forearm. So we have a lot of pickleball forearm, elbow pain, those kind of things. There's one thing, we all know how to stretch those in general movements right here, but we want to kind of point it out a little bit of what we see in clinically, we make a little bit of modifications right here, is you can use yoga mat, floor, however you feel comfortable, countertop at home, if your height will be appropriate. I do not want you to do not stand on the stool, try to stretch on that part. We're gonna start with a side movement. I think we have a demo right here, and then Dr. Ria is going to show you around this one right here. So a lot of time when we stretch, our fingers are off the edge. So not a sideways, so everyone can see it right here. So what Dr. Ria is doing is actually going to move that finger over that countertop, so that way we are actually stretching a lot of intrinsic flexors muscle that goes all the way to our fingertips, because that grip. And then you're doing your best. You can do 90 degrees to 45 degrees, and it really depends on how much of a tolerance is. You're gonna starting to lean back, and then you're gonna switch to side to side. How long should you hold for? We recommend 5 to 10 seconds would be the most, and I do not recommend holding longer than 20 seconds, because that kind of defeats the purpose of what we're trying to do. We're trying to trick our body, those neurons, those nervous system, actually trying to kind of to have a little bit of a relaxation technique right here. So you can do back and forth, and the forehand, the backhand to kind of stretching out the upside. And also we all know one you can pull on that backhand to stretch out our forearm. It's called extensors, and so you can do those kind of things too. And that form exercise, you can do this dynamically before the game, and that's another reason why we don't recommend a sustained holding for a long time, because that kind of shuts off the muscle a little bit more. So you want to be more dynamically, okay? And then the second thing is our calf stretching. I think it's this way. So this calf stretching, you can do at home, you can do it on the court, but you definitely need to find somewhere has a surface that can help you to stretch your toes. So with that being said, we all know the wall stretching of a calf, like our body going into the wall, and that is a good way to stretching that one. But sometimes when you go to the court, they might have a bench and things like that. You can actually bend your upper back. So that's my favorite, because that actually starting to stretch the whole kinetic chain right here. So what you want to do is you want to put that forefoot against the wall or chair, And in the meanwhile, and I think it will be easier to use a chair right here. I'm kind of just showing everybody how to do this, and Dr. Rios can show that on the other side. So I'm gonna just walk you over this one. You're gonna find a very sturdy chair or a little bit of a bench that doesn't move. You put your toe against it, and then stand feet apart, almost like you're trying to do a functional squat. With that being said, we're stretching on the left side. You do a hip hinge, relax your back, and try to hold there for about 5 to 10 seconds. You should feel your toes, the bottom of your feet, all the way to your hamstring. So it looks like I'm gonna do this on this side again. So find something sturdy, put your foot up so your toes are actually against the wall right here. Feet apart, so almost like you're doing a squat. Then you want to bend at your hip and you find right here. So you should feel something like in your calf. You feel like, whoa, that's a different muscle I haven't felt than regular calf stretches. And how many should you do? 3 to 4 repetitions will be just fine. Hold for about 5 to 10 seconds, and you can do this before the game, you can do this after the game, you can do anywhere. You can office, at home, just make sure it's not slippery. And sometimes at home, you can even take your shoes off, socks off if you have a carpet, to really stretching that toe muscle. And, that will relieve a lot of tension, not just from pickleball shoes, just daily, every day you wear that way.
Amazing.
Yeah.
Thank you so much. Thank you, Dr. So, any other questions? Yeah, go ahead, Ashley.
So this is regarding the post-game wind downs, right? Anything that you guys recommend? We have seen how we warm up, how we hydrate, but I'm just thinking anything we need to do after the game to kind of wind down. Thank you.
So the cool down is both for your heart and your muscles. So we can still do the same stretches that he showed, especially the hand stretches that he showed and the calf. All those are to kind of improve circulation to the muscle again. And then most of the yoga poses, to be honest, they do stretch the whole body. So whether it is a down dog or a side stretch, all those you can do, because pickleball involves all kinds of movements. Yes, you are more on your feet, but you're using your hands, you're using your waist, you're using your chest, everything. So all those, any kind of poses for any other exercise that you do can still be used in the cool down process for pickleball.
Thank you.
Yeah, I totally agree, and that's another thing needs to be addressed is cool down. And when you finish the game, you pack the bags, you leave, and you sit in the car for 30 minutes, and when you come out of the car, everything is tight, right? So nowadays there's not a lot of technologies that is available. So we've seen a lot of players, they have their own recovery kit, vibration percussion tools. And also, once you get home, if you live nearby, and get onto the foam rollers. The foam rollers, they're very, very economic, and they are very, very easy to carry, and it's very lightweight. And what it does is amazing things, mimicking a myofascial release manual therapy, so that actually will reduce the potential delayed onset muscle soreness to help your body to try to pump, that circulation to get rid of a lot of lactic accumulation. So you feel you recover faster too. And those two tools actually has been proven clinically. It has the very, very effective results for it. So that's another thing you might want to consider to adding to your post-game recovery and cool down gadgets in your bag.
Thank you.
Awesome. That's great. Thank you so much. So I just wanted to thank Dr. Lee and Dr. Uma for taking time of their busy days and joining us. And I specifically want to thank Unni Krishnan Valat. Hats off to you he's a streaming lead and the audio and video specialist. He put many hours because to have this talk go live throughout the world. And I want to thank our partners and sponsors, CloudQ, Healthrock Chiropractic and Sports Medicine, Diadem, Anushibu, our realtor, and Bridget, our CPA, and the CDX Insights, and obviously to the Sharon Springs Library, and for all of you to taking the time to joining us. Thank you so much. Dr. Lee would be available for any personal questions. Thank you. Have a wonderful day.